The coronavirus pandemic here in the U.S., the virus now taking more than 1 million lives worldwide, and 1/5 of those lives right here in the U.S. More than 205,000 American lives lost now.
Close the bars and keep the schools open is what we really say. Obviously, you don't have one size fits all, but as I said in the past, and as you accurately quoted me, the default position should be to try as best as possible within reason to keep the children in school or to get them back to school. If you look at the data, the spread among children and from children is not really very big at all, not like one would have suspected.
All I hear, Dr. Fauci, is we can't do this, we can't do that, we can't play baseball. Well, even that's not based on the science. I mean, flu season peaks in February. We don't know that COVID's going to be like the flu season. It might, but we don't know that. But we wouldn't ban school in October. You might close some schools when they get the flu. We need to not be so presumptuous that we know everything. But my question to you is, can't you give us a little bit more on schools that we can get back to school, that there's a great deal of evidence and it's actually good evidence that kids aren't transmitting this. It's rare and that kids are staying healthy and that, yes, we can open our schools.
Mr. Chairman, do I have a little bit of time to?
Well, I give you a little. That was well over 5 minutes, but we'll.
Thank you, Senator.
Go ahead and answer. Please answer.
I feel very strongly we need to do whatever we can to get the children back to school. So I think we are in lock agreement with that. I agree with you. I am completely unqualified to tell you whether you can play a sport or not. The only thing that I can do is, to the best of my ability, give you the facts and the evidence associated with I know about this outbreak. Thank you.
That we don't know everything about this virus, and we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly, and particularly those with underlying conditions. But I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions. Thank you.
Our experts agree. Most children don't get as sick as adults, and that serious complications are rare.
This has been a strange pandemic because usually for respiratory viruses, children are the first and the most substantially affected. And this has really been a flip of that, where it's our adults, and particularly our older adults, that have been more affected.
In fact, kids only account for 2% of all cases. Doctors say they don't expect that number to significantly increase when schools open because kids don't appear to be good at spreading the virus.
Just as New York City elementary students went back to the classroom, schools already at risk of closing. The city reporting its COVID positivity rate ticking up above 3% for the first time since June. New clusters traced to 9 zip codes. Tonight, a new report from the New York Times says over the summer, White House officials tried to pressure the CDC to play down the risks of sending children back to school.
The default position is that you should try to the best of your ability, with all considerations to the safety and welfare of the children and the teachers, we should try to get the children back to school as best as we possibly can. With that as the framework, you've got to look throughout the country that the level of infection is different from region to region, state to state, county to county. So there are going to be some counties where there's no problem. Take the kids back to school, they're not in danger. In those areas where it's iffy, where you see that there's a degree of infection, then what some schools will do, short of just shutting down, and some authorities may decide to do that.
If the schools are not safe, I'm not going to allow them to operate, period.
Is to do something with a little bit of creativity, maybe alternating classes, spacing of the desks for children who can do it, wearing masks, protecting the vulnerable. So you can go from one extreme to the other. You've got to say, I'm going to try to open the schools to the best of my ability, and if there are issues with activity of virus, try to mitigate it by some creative capabilities. And I think that's what you're seeing as different states respond to the mandate to open schools.
Olivia Troy, a former aide to the vice president, sat in on task force meetings.
It was people within the White House specifically tasking more junior level staff to try to find alternate data that fit the narrative that they wanted, which was it only affects, people above the age of 75, and it doesn't affect younger school children. It was all part of the narrative of we need to open up these schools.
Well, kids across the country have been cooped up for weeks, if not months, because of the extended COVID-19 lockdowns, and it may really be taking a toll. A recent report from the England charity Childhood Trust warns that kids and teens may develop serious mental health conditions because of the pandemic, including PTSD.
And the White House pushing back on that New York Times reporting, saying that the task force brings together experts with different expertise and views. David.
Eva Pilgrim with us tonight. Thank you.
Are kids as good at transmitting the virus as adults?
The data that's come out now seems to show that most transmissions occur from adults to adults or adults to children.
The younger you are, probably the less likely you are to be able to transmit the disease.
While many teachers are concerned about reopening school so soon, the 5 doctors we spoke to agreed. The benefits of being in the classroom far outweigh the risk of disease. But the key is to reopen safely.
We are not seeing transmissions when we're following some simple guidelines.
I think each school system is going to have to come up with their own guidelines because you can't just say that one city is just like the next.
All agree guidelines should include rules for social distancing. Keep desks 3 to 6 feet apart and make sure desks aren't facing each other. Schools may want to consider holding gym classes outside. In your perfect world of sending kids back to school, what would you like seeing set up in those school systems?
They should try to increase the airflow in the classrooms, try to distance as much as possible. I have been doing a lot of research looking into face masks. I don't think they're necessarily useful in elementary school children. They do provide protection, I think, for high school students.
If you look at the data, the spread among children and from children is not really very big at all, not like one would have suspected.
Would you let your kids go back to school?
I will. My kids are looking forward to it.
Yes. Period. Absolutely.
Absolutely. As much as I can.
Without a hesitation.
Without a hesitation, yes.
I have no concerns about sending my child to school in the fall.
I would let my kids go back to school.
Dr. John Torres, NBC News.
They all said yes.
And in Italy, they sort of did a study that revealed that children seemed to be more irritable. They had trouble sleeping. They appeared more anxious.
Withdrawing, emotionally cutting people off, or in adults or teenagers, looking to substances as a way to regularly manage distress.
Are you confident that students and teachers will go back safely to school in the fall?
No, I think what we heard from the secretary was malfeasance and dereliction of duty. This is appalling. They're messing. They're messing. The president and his administration are messing with the health of our children. Going back to school presents the biggest risk for the spread of the coronavirus.
What happens when you lock children in their rooms in front of screens and prevent them from experiencing human contact? Has Nancy Pelosi ever been asked that question? Has she ever wondered about the answer? According to the Centers for Disease Control, a total of 522 children between the ages of 5 and 14 died of suicide in 2017. In that same age group, only 42 children have died from the coronavirus so far this year. What are those suicide numbers going to look like if we continue to take Nancy Pelosi's advice about the health of our children? We already have some indications of that. Future years will reveal the whole picture, and you can be certain it'll be horrifying. But for right now, with incomplete data, here's what we know. In St. Paul, Minnesota, for example, 40% of all grades given this year have been Fs, and you can be certain they're grading lightly, but it's still double the normal amount of failures. In Fairfax County, Virginia, the number of middle and high school students with failing grades in 2 or more classes has increased by 83%. The number of students with disabilities who are failing 2 or more classes has increased by more than 100%. In a lot of school districts, huge numbers of kids never even registered for online classes. Do you have kids? Do you know anyone who does? They're learning nothing. Those are real consequences. If you want to know the health of a society, look at its young people, look at its schools. These are obvious points that are being roundly ignored, and anyone who makes them is attacked for making them. We're going to look back on this moment in shame. Back in June, we interviewed Dr. Scott Atlas. He was then a member of the White House's coronavirus task force. He was one of the very few people, then or now, brave enough to make a simple point. Here's what he said.
But the point about the schools is really critical because this is the most irrational public policy probably in modern history. Children have virtually zero risk of getting a serious complication, virtually zero risk of dying. You don't lock down the children because you are personally afraid. It's totally outrageous.
Dr. Scott Atlas was attacked as a monster for saying that, really attacked. Dr. Tony Fauci, by contrast, was deified. Signs throughout Northwest D.C. said, "I believe Dr. Fauci." But the truth is that Scott Atlas was right, and Dr. Fauci was revealed as a power-mad incompetent. That's not our opinion, by the way. The data prove it.
I love that. That is news you can use. I know I use that phrase a lot, but I love it when we give people takeaways they can actually implement like right away.